Oh, wow.
Good evening, everyone.
Hey, everybody. Sorry, we're really small on the screen right now. Can't figure out why, but oh, yeah, go to there. Get one of those. Not that one. There we go. Hey,
Good evening.
good evening. Welcome to the Oddcast podcast.
Off the record,
I'm Blackie.
I'm Erica.
Thanks for joining us again. If you're new, which I don't see anybody new in here, thanks for being here. If you've been here before, thanks for returning. We highly appreciate it.
Yes.
Today, we're going to kind of have a discussion about some healthcare conspiracies, just talk about the healthcare system in general and the kind of things that we've both seen throughout the healthcare system that we've experienced. Obviously, we're not doctors, so that's why we put a disclaimer at the beginning, because we don't want to tell, we don't want anybody to think that we're giving them professional opinion. So thanks again for joining us, and let's have a discussion.
Yeah, so there are several topics we'll talk about. And again, we're not professionally trained in the medical field, but we have lived our lives and had experiences and spoken with, a lot of people and hearing their experiences. It just raises a lot of questions for us. And we're not afraid to speak our mind about that. So really, we are definitely looking for input, from the chat. If you have anything to add, or if you question anything that's related to what we're talking about. This is also a very wide range of topics. So it's definitely possible that we would have a part 2, or go deeper into some of these subjects or add to our subject matter.
Absolutely.
So we're talking about conspiracies in the healthcare industry. And again, it's a lot of asking questions. Okay. So we're curious about how doctors promote their medications. What are their reasons for the medications that they prescribe, that they would favor one over the other? And so we're not talking about the scientific reason. We're talking about other things like incentives, and are they paid to promote these medications? So we've dug a little bit into it, and it is hard to find a lot of information about it, but that's not surprising. So, but we're just curious about that. And some of the information said that doctors may receive gifts or samples. They may be paid. And there is a website that I found that shows how much doctors have been paid. And they say it's at an attempt at transparency is what it is. I don't know how open and honest, I still feel like certain things are hidden. But the website that I found.
Can you put the comments up so I can read the comments?
Yeah.
Good.
The website that I found is https://openpaymentsdata.cms.gov. And it will tell you can search for doctors and or practices, and there are different types of them, but it will tell you what they've been paid, and it's very detailed. It looked to me like it was more of meals that the doctors had. It wasn't like, under the table kind of secretive stuff, but it to me was more like meals. You still can go on the website. It's like the Center for Medicare website. So they'll give you dates and how much the doctors were paid. It's interesting. Again, I don't know how complete that information is, but it's nice that they're attempting that. So other things that were said, another article I read is this was, saying that doctors receive thousands of dollars a year from drug companies. And this says that the Open Payments Database, which is what I just mentioned, the website, is maintained by the federal government Centers for Medicare and Medicaid Services, and it keeps track of financial interactions between physicians and drug and medical device manufacturers that exceed $10 in value. This can include free food at sponsored seminars, consulting fees, payments for conducting research, or investment stakes in such companies.
Which should make you think to yourself, I know there's a lot of honest doctors out there, but there are also a lot of dishonest doctors that are in it for the money that'll just take what they can get any way they can get it. Because I know one of the things that's the doctors have issues with is the amount of insurance they have to carry because of malpractice, the malpractice insurance they have to carry, and that's a big deal. One of the things I can mention is the reason doctors have to carry so much insurance because of the amount of medical deaths caused by different types of malpractice, whether it's a surgery issue or a drug prescription issue. These happen all the time. And I think one of the numbers I read, that happens between 40 to 250,000 times a year. There's medical malpractice suits on doctors, and obviously multiple doctors. And there's a lot of issues that we go through and a lot of things that doctors have to take care of. So they have to carry that medical malpractice insurance, and they have to be careful. Everybody's sue happy, so they're going to sue for just about anything.
Mm-hmm. And I shared Gary's comment. We are really indifferent, about who prefers what, but we're here to share that information, so I shared his comment, and that hopefully may help someone who's in the chat or who watches this video. So, but we don't really have a preference, so we're not going to be hiding information. We'll try to encourage as much as possible. But, I've worked in medical billing in the past, and what Chad was just saying, my dad had open heart surgery several years ago. And I remember hearing the nurses saying, well, he's on Medicare. And so it was in reference to how many days he was staying in the hospital. And I know that this occurs. I just don't have specific examples, but it is a big game. It is preferential treatment on certain things. And that's another, I'd like for everybody to raise their voice on that too.
Absolutely.
But, okay, so we're kind of going to jump around a little, but it's all just, like I said, there may be a part two.
I mean, I'm sure a lot of you all have had, we're all getting up in age, and we've all have, at one point in our life had to take medication. Some of us have to keep taking medication, whether it be, high blood pressure, diabetes, whatever. There's so many. You should question the medications you're taking. If a doctor prescribes a medication that you don't know of, research that medication for yourself. Just find out what possible, I always make fun of the drug commercials on TV because sometimes the side effects seem worse than the reason you're taking them. So
another, being under a doctor's care, you wonder, and you actually do see changes, through the years of new medications, or you may have multiple that do the same job, but have different, chemical makeup, obviously, and then different side effects. Maybe you interact with other medications, differently. But I know for myself, as a young adult, my doctor,
Denise's comment, yeah.
My doctor suggested, like, he gave me samples of a birth control medication. And a while before that, I had been in a very bad car accident, and they were worried about me having seizures and having a history of a blood clot from that accident. For a long time, they said, don't take birth control. So I didn't. And I took that doctor's sample home with me, but I ended up not taking it because I couldn't get that out of my head that it might be a bad thing for me. So I never did. But, I still remember the name of it and everything. And it just was kind of like the new thing then. And I don't think I've heard of it since then. So those things make me feel a little distrusting.
Yeah, and like for me, I have bouts of depression. I will say that they're much better now, but I've had bouts of depression where I had to take some medications that they gave me, and it was back in the time when I was like, okay, sure, I'll take it. I'll try anything. Let's try it. And it ended up the medication that they gave me was one called Cerazone, which has since been subject of a lot of lawsuits. That for me in general, when I was taking it, I couldn't sleep at all. I couldn't eat. I wasn't hungry and everything like that, which, took my depression to a whole nother level.
Mm.
And, I actually, when I went off it, I was so much better for not taking it than I was. And I'm not saying every medication's that way. We all have bodies that are different. And that's the hard thing for, I will say, doctors to do. There's so many medications for some, how many of you are on high blood pressure and you're given this medication and that doesn't work. It might make your blood pressure worse, or, so it's really hard for doctors, I think, to prescribe certain medications that are right for you. Mm-hmm. So again, question everything, work with your doctor and ask questions while you're there, because we know people that don't ask questions while they're there and they just go, okay, I'll take it. So that's what we have to worry. Don't be that person, ask questions.
Mm-hmm. Yeah, we're getting a lot of input, which we love. So we're going to be sharing that. But there are crazy charges, things that, to an extent, there are supplies that they use. I can see why they would charge, but a lot of things, like Chad said, end up being overpriced because of the lawsuits, and doctors have to cover their insurance, and it's just crazy. Yeah. So many questions, but the next thing I wanted to cover is abuse of medication. So I question, what started the opioid crisis? Was it over medicating by doctors? And Denise just said something that kind of, I think, related to that.
Or she was taking fentanyl.
Yeah, they were prescribing fentanyl, but wouldn't do a Tylenol. I can't see.
And Tylenol is what worked. I believe that's what she said. But the insurance wouldn't cover the Tylenol.
And it, so there's what's that?
Williams, put that up there, please.
Oh, okay.
Now, if anybody's going to help us in this situation and talk to us, it's going to be this gentleman here.
All right.
Being a retired oncologist, gynecologist, all kinds of things. He's dealt with this industry. Mm-hmm. And we'll probably have him on here in a second, but we kind of wanted to hit at a few things. And then if he wants to throw, some shade at us, just kidding. If the information, would be, very beneficial from him.
Right. One of the articles I got, this is just a part of the article, and are doctors responsible for the opioid epidemic is the title of this article. It's from Health News. It says, accidental or not, overprescribing opioids are causing a lot of pain and suffering in America. The main cause of accidental death today is overdose, which is probably still true. Some also point the finger at huge pharmaceutical companies. They have forcefully marketed opioids to physicians. At the same time, they downplayed their addictive nature to sell more opioids. Purdue Pharma, OxyContin's distributor, agreed to this agreement in 2007. Then they entered into a multi-million-dollar agreement with the federal government. Doctors have a responsibility to patients, despite the role that big pharmaceutical companies might play. An obligation to many believe is not being met, and the reasons are becoming clearer. Recent studies have shown that 91% of patients who survive an overdose can still receive another opioid prescription. mostly from the same medical provider, which is insane. It's so addictive. That's insane. Dr. Sanjay Gupta said we doctors failed to learn and make progress. We also seem to turn a blind eye to the tragedy unfolding right in front of us. That's crazy. But over medicating, there are a lot of ways that they over medicate. Unfortunately, that can take a toll. I remember in high school, I had a health class, and it always stands out to me. They talked about then, and this was over 20 years ago, that that the pharmacy and the doctors need to pay attention to what that patient, what they are prescribed for medications, and more goes into that. But counteracting with other medications, and they can be held liable. It just seems like it's not always the case, but you get that feeling of just, here, take this medication. And so I don't know how much they do that as far as consider what all is there and what can be affecting another medication and counteracting it or causing more damage. It's all a lot to consider. But that article about the opioid, again, was with Health News, and that was a 2021 article. But another over medicating, there are other issues. So over medicating, can run into issues with inventory of the medications. It can cause, healthcare facilities or pharmacies to run out of medications.
Yeah.
But then you also have things like Ozempic, where, in my opinion, it was over medicating for the wrong reasons. And a lot of this all goes back to ethical practices. The true reason of Ozempic is not for weight loss. It's insulin related, and they saw dollar signs, I guess. I don't know. And people need help to lose weight. That's not a thing. But people whose life depended on Ozempic were in danger, because of vain people. It's just like taking in the whole picture,
I think one of the things for me is I was diagnosed, and I say this with quotation marks, with ADD, which I, at this point in my life, think that is kind of a made up disease. I mean, a lot of people don't pay attention. I won't say that. A lot of people I don't pay attention. So when she's talking to me, my mind is elsewhere. I've been that way since I was a kid. And I think a lot of people that way, if not everybody, gets to a point where they're that way. But I know my doctor at the time would prescribe Adderall like it was, oh, here, what do you want? I'll give you this much. I'm like, do I really need that much? He's like, you're not going to OD on it. I'm like, okay. And then I hear of kids taking, 50 tablets at a time. And okay, well, maybe you can OD on it. I don't know. I wasn't even thinking about that. I was taking my prescription. The only thing it was doing for me, I don't feel I was concentrating anymore, but I was not eating, and I was awake longer. And I know a lot of college kids were taking Adderall because they could study longer. It would keep them awake longer. And, to me, maybe you should just take an energy drink, or, well, not even that for health reasons, but just, take a nap and study. I don't want to ever push something that's going to hurt somebody medically. And I kind of feel like my doctor at that time was pushing something on me that maybe he was, in my opinion, getting some sort of kickback on it or whatever. I don't know. So
Henry says the VA ran out of morphine, and that's very unfortunate. It's just,
the VA should never run out of anything. Sorry.
Well,
I'm a pro veteran guy.
Well, let's see what Billy says. I developed a dry cough. They gave me cough syrup. I kept coughing, so I investigated the meds I was on. Turns out my blood pressure medications cause a dry, hacking cough.
Perfect, Billy.
I went back to my doctor and told her, which, yes, good for you,
Good
Billy.
for you, Billy.
And I know someone who recently had a family member who was constipated and had at least 3 visits to the ER. And
Wow.
they said, I haven't investigated this myself, but they said they didn't have an answer at first, went back again, kind of the same thing. Then they were put on morphine. They said that causes constipation. So, to help with the pain, but we're still going after the same or resulting in the same issue. That's just, and I don't know any of that to be true. That's just the story I was told. And so it goes along with this.
Right. One of the things that, while we're on it, I mean, so I'm sure a lot of us in chat, a lot of people in chat, I won't say us because I'm living off the land right now and I feel like I'm healthier than I've ever been, but I'm not saying that's the way to live. But a lot of people have to deal with price gouging. The price that you pay for certain medications has gone through the roof, or maybe it's coming back down for you now. And that's a good thing, because there's a lot of people I've talked about on previous shows. We live in a small community where there's a lot of veterans that don't have a lot of money. There's a lot of poor people that, obviously don't have a lot of money, hence the reason poor, but they can't afford some of these medications. So they're just trying to get by the way they can. Yeah, there's a lot of other ways they can go around that, but they don't want to owe anybody any money or whatever. They just want to survive. So the push of natural remedies is a big deal, which we'll get on here in a bit.
So Billy was explaining more, and William said, coming from a doctor, but you can't predict who that will be, which is, if we take in the big picture and we take in, hopefully that's listed on the symptoms or side effects for that. So I can see what he's saying with that.
Absolutely.
And I've heard that before, Bud, and that's definitely agreeable.
You're in my market, Bud. That's what I think. But so I'll hit that here in a bit.
Mm-hmm. Okay. So the next topic we're going to cover is, as Chad said, price gouging on medications. And an article I found, this was from May of this year. It was describing, I'm just going to literally read the key points from this article. The name of the article is Why Americans Pay So Much More for Prescription Drugs. The key points, it says, this was a CNBC article. Key points: Trump signed an executive order to lower drug costs by tying the prices of some medicines in the U.S. to the significantly lower ones abroad. A 2024 report by the Rand Corporation found that drug prices in the U.S. were almost 3 times higher than in 33 other high-income countries. That's largely due to the U.S.'s highly complex and fragmented reimbursement system and lack of national pricing control. So we know we have our variety of, that was on Good Art. Yeah, that was a CNBC. We have our, I think it's called price schedules or fee schedules. So in between the government insurance and the private insurance, they charge different rates. It depends on the healthcare provider, but they can be different rates, and then the rest can be up to the provider. But I still don't think that's as much to do with the prescription medications as it is, the services. In my personal opinion, I think that's different for drug prices. But apparently we are higher than other countries significantly.
Yeah, we've never been overseas, so we don't know. And we just what we hear. And I'm not a fan of going by that, but that's what we hear.
Yeah. And I mean, if you just think about it, different countries are going to be different because they have different diets, they have different foods, so a lot of it is tied together with healthcare and medications and the human body.
I've heard people, say that, oh God, I want Canada's healthcare system. And people say that, but yet if you look at Canada's healthcare system, you might wait 8-9 months to have a major surgery because it's so backed up, and you could die in that time. And it's probably same with the medicinal, the pharmaceutical end of it as well.
Mm-hmm.
So we call that socialism, and I'm not pushing that. I'm not going to get into that part, but there's a lot of things that we really need to think about. Again, question it. Like Billy questioning his blood pressure medication and looking it up for himself and finding out that was, coughing was one of the issues. So
check out William's comment. That's awesome.
Nice, William. Thank you for adding that. That's awesome. You made this show what it's supposed to be.
I know.
A little humor in there. Absolutely.
Yeah. So we have a lot of other topics. We're just barely touching on these because we want this conversation as just natural Americans or, people. We have some people from overseas. And we all have questions and we
should have questions.
Mm-hmm.
Again, if you've watched the show, question everything is my motto. And I ask everybody to do that, even with your medications and whatever. I'm not a doctor, and not every doctor is right. So question it, research it for yourself.
So Big Pharma, we will have a show just on Big Pharma because there are topics that we wrote down, but we would definitely like to provide a whole episode on Big Pharma and movies to reference and just, trying to make things more visible for everybody.
Absolutely.
So we'll do a Big Pharma episode later. Okay. Real quick on the pricing for, US, I do have this to say. In the past, I have found when it comes to medications, no matter which employer I'm going through and the insurance company that is, I have found that sometimes the price that I pay out of pocket, considering copay or whatever that covers, GoodRx has been even better than my own insurance. And it's a service. I'm not paid to promote them or anything. I'm just trying to help whoever needs this. GoodRx is a website, and you look on there what medications you need and which pharmacy you're going to get it from. And it kind of like you print out a coupon kind of thing. But they've had some great prices that have really helped out. And when I hear people that are struggling for whatever reason, and they really need this medication, but it is crazy expensive. It's unbelievable that you can just go to this website and pay $4.32. Like, it is crazy. So it's GoodRx. I personally have even used it on veterinary medication. So we try not to take prescribed medications, but in the past I've had good luck with that, and it doesn't take I don't know who that goes against, who doesn't support it or whatever. I don't know. I don't think you can use it in combination with your health insurance.
Yeah.
But I have had good luck with that. And if there's anybody who's really struggling, I will definitely recommend that to them.
So while we're talking about, GoodRx and website stuff, I will bring up things like WebMD and internet stuff, because if anybody, I've looked up like, oh my God, I've got this cough and I've got this pain and I got this and that. And by the end of me reading some of this stuff, I've got some, disease that's incurable and I could die. So really, we did this before when we moved into this condo or cabin, excuse me, from our condo in Dayton, Ohio. I kind of went through some anxiety issues and was like so worried about everything. I've got this, I'm feeling this way, I need this. And I was using blood pressure wristband thing and checking my blood pressure every day. And it was always high. It was always some crazy. And then I would move it a little bit. And I was like, oh, no, it's normal. And I got to the point where I was worrying about it so much. And I would look up, I would be like, okay, let's see. My blood pressure is this. And what do I have? Oh my God, I've got high blood pressure. Or one night I thought I had, what was that? Vertigo. And it ended up being, I ate a little piece of a THC gummy and melatonin and found out that the gummy was to help me sleep. But then I also took melatonin. And from what I found out through going through multiple internet doctors, researching it, was that I probably kind of OD'd on melatonin, too much melatonin in my system. But I thought I was on a pirate ship that was in a very rough sea. I was going side to side to side. And then the next day I woke up just fine. So anyway, a little humor.
Yeah, it can be helpful to look those things up, but you definitely need to consult who's fitting for that issue in your area. Okay. It's so funny right now because Patrick put this, and this is my next topic. He said most drug commercials are 30 seconds on how good and 30 seconds on how they will hurt you.
That's what this article is about right here.
So that was the next topic. And yes, it's true. And I'm not going to go into names or anything, but I will say this, okay? We have realized recently, because we've taken a lot more road trips than normal. And so when we're in the hotel, we see cable, if you want to call it. Well, we don't have cable at home, and we haven't been missing it. And when we're in the hotel room and we turn on the TV, we realize why we have not missed it. And it's unbelievable how many medication commercials there are. And it's sad, but they try to paint this pretty picture, but then you hear the side effects, and we don't get that on the TV that we watch at home. But it's alarming at how many medication commercials there are on TV right now.
The fun one for me is plaque psoriasis and, itchy skin and bumps. And they're talking this can, plaque psoriasis, and you can feel much better in days. Side effects include death, suicide, all these things. And you're like, why? I have itchy skin. It might not be the prettiest thing in the world, but I definitely want to die from the medication, which, like William said earlier, every medication is like that. Everybody's body's different. Our bodies react differently to everything that we do. And that's what a drug company has to do, is put those on there. Again, question what you're taking.
Yeah.
And so.
I mean, it is sometimes you're just rolling the dice, but wow. And I took a medication once. I'm not going to name it, but I felt that it was very necessary. And I would not ever recommend it to anybody else again. I had the worst side effects that I've ever had.
You should probably tell them what it is.
No, I'm not going to tell them.
Oh, yeah, you probably
it's
should.
Coming out later. It's coming out later. Okay. And so it was necessary, I felt, for me at the time to get to where I felt like I needed to be. But anytime somebody talks about this, I say, this is what happened to me. Okay. But it is alarming and it's sad when you hear people talk about they're on at least 6 medications, and it's just sad. I hate to hear that for anybody.
Absolutely. I want to touch on something Virak said. Isn't melatonin meant for sleeping? Absolutely. That's what it's meant for. Our body produces melatonin. The problem is the THC, from what I've read, creates something similar to melatonin. That's why when everybody smokes marijuana or whatever, they relax. It creates something very similar. So technically, I took probably two or three melatonin pills plus that gummy, and it really had an effect on me. I'm not saying it affects everybody that way. Hence the reason we've also just said that these medications that people take affect you different ways. Different people, our bodies are different.
Exactly. And Denise is giving a perfect example right now. She said Benadryl puts me to sleep, yet it makes my sister jumpy. And we've heard of other examples like that that are similar. And, you know, we're all, even though we're blood related, we can have totally different reactions.
Yeah,
So,
absolutely. If I can touch on something right now, one of the things I would like to talk about is what is called disease mongering. And disease mongering is pretty much that they push. Here's the great story that I found with disease mongering, and it has to do with Listerine. We all know Listerine is a mouthwash. You put it in your mouth, rinse it out, cleans teeth, it cleans your breath, whatever. But originally, Listerine was a surgical antiseptic. So something that they used to clean out wounds, to do surgeries, that's what Listerine was for. From that, it became a floor cleaner, and then treatment for gonorrhea. So, Listerine went through all these different things, and then it became a cure for something. So they created the disease, and the disease was halitosis. And I think we all know what halitosis is. And that's that lovely bad breath. Which, is that a disease? No, it's not a disease. And I think a lot of that has to do with a lot of things that happen. They create something, and then they have to find what this is the creation for. And now I don't feel I need to touch on a lot of things that are recent with that. But it was, a big deal that we've created something that was supposed to cure something, but they needed something for it to cure. And then they come up with and this is a conspiracy theory or a conspiracy truth in my book. But, there's other diseases that this has been proven true with. And with the drug companies, drug companies, in my opinion, don't create cures without kind of creating the disease sometimes. We've heard so much in the past 30, 40 years of diseases that were never big until now. Now, whether it's governments creating biowarfare or whatever, we didn't hear about that until X amount of years now. So who knows? It's you can use my brain and say that's a conspiracy, that something's going on, or maybe these are just natural things that have happened. Maybe it was a bat virus in a wet market in China, that kind of thing. That's for you. That's for you to question and for you to try to figure out.
So Pyro said our country is 5% of the world's population, makes 80% of the drug companies' profits.
That's, yeah. I mean, from what I've read, that's pretty true. But what I've also read, and we're going to have a dog that we don't know pay us a visit here on the porch. What we also know is that a lot of these big pharma, let's say the PF word and some of these others, aren't the ones actually producing the drugs. They get companies from overseas build these drugs. Thanks. Okay. They get these other companies from overseas, and a lot of these companies from overseas, stop talking to the dog. Some of these companies from overseas have been companies that have actually been shut down in Europe because they're producing things that aren't working, or they've been in trouble for doing things incorrectly. But the United States is like, hey, bring it on. Let's do it. We can make it cheaper. So that's the things you kind of have to worry about. And that's not stuff the normal people are going to know unless you're researching everything. And that's what I've found in this research. Yeah. Halitosis and gonorrhea. I saw that. Right.
Or the combo.
Drug companies exist to make. Okay. Put that up there. I agree, William. That's something big. And, I was a doctor. That's interesting for you to say. And I appreciate that for sure. It's to make people feel safer. I'm assuming that's what you're saying. And that's how they're producing it, is to make people think they're feeling safer.
Or to make them feel like they can be perfect, to make them feel like they can be disease free or without symptoms of whatever. Some people may need that feeling.
I would like to put, if we can right now, or if you want to keep talking, is put a link in the chat for William if he's just interested in getting on. If you're ready for that, William can be a real tiger.
Tiger. What's that?
Can't remember how to do it. Invite, and I'll give you that copy, and then put it in. Nope, down.
Okay.
I agree. I'll agree with that too, William. Definitely.
Chad said something earlier about natural cures, and we'll definitely do an episode on that. And he says that they try to suppress natural cures. He also said something about suppressing generic drugs and the evergreening, hiding a cure for the big old C word. And
yeah, I want to put there too.
In the last 6 years. That's good to know.
And I don't, Robin, I hope that would work for everybody. But it's gonna take people to be a little brave to try stuff like that. And I push that. I'm totally for that.
Yeah, I've done the oil pulling before. I felt like it was a weird feeling, but I've heard of people having good success with that.
Go up to Billy if you would. I think you're on him right now. Well, on this thing. William, I don't agree with that. I'm a consumer. I don't want their drugs. I want to be treated by my doctor, not given pills. And I'm glad, that's that's good. I mean, you should always, again, that's a question thing,
Mm-hmm. And then taking into account what the issue is, your issue could be so many different. We're just talking about in general. So it could be so many different, you might have a hurt bone, we're not talking about like heart related or things like that. And it's just, it's the big picture. It depends on what your situation is.
Again, we're not doctors, so we're just having a conversation.
I don't know about the earwaxing. I've heard of like so many different methods, and I don't have any personal experience with that, but vitamins, I feel like we could do an episode on that.
What I will say about the vitamin industry, if I may, is that a lot of the big corporations, the PF word and all the other ones, have bought these small corporations, these small companies, anyway, that make vitamins. So, Nature Made is, I don't know who it's owned by, but I know it's a big vitamin or a big pharmaceutical corporation. And they do this because I think, in my opinion, they're trying to keep the natural remedies away. If they own it, they don't have to make it a natural remedy. They can just give it a natural remedy name, and you take it. They can still add stuff to it. So I don't know. That's my opinion. Again, that's my opinion.
Okay, 2 things. I'm sure Rusty will be back with us, but Patrick said it's trial and error. I feel like that's totally true.
Yeah.
Sharon, who's in Belgium, put, does cable TV promote certain meds more in different states more than others? I bet they do.
I would think that if they're, I'll be honest with you, and I don't want to seem, I don't care, but I think if you have a bigger black populace, they might promote certain drugs over a bigger white populace. It'd be a different drug they're promoting.
Yeah, and it, on diseases that they might have more than other populations, it might be more fitting that way to try to help them. It might be that way because they know that's the market and they're trying to push that stuff. We don't know. But that's a great question.
Oh, he's back.
Okay.
Ladies and gentlemen, please welcome
Hey, Rusty.
Dr. Rusty.
Dr. Rusty had a technical glitch there.
Oh. Glad you're here.
Yeah, we were
thank
really hoping you would get on here with us.
Well, I'm glad to be here. You know, this always gets me excited to talk about this kind of thing. I thought about it for decades, almost every day, in fact, both from personal and professional experience. So I'm always interested to hear, what other non-healthcare people have to say. I can tell you just overall healthcare practitioners, specifically physicians, but probably most healthcare practitioners, including nurses and so forth, will tell you the U.S. healthcare system is badly broken.
Oh, I agree.
In a lot of different ways. And it's not necessarily because of the desire to make money. Oh, that's a lot of it, certainly. But some of it's just things we've stumbled into. We just have made the healthcare system what it is almost by accident in the U.S. And what I meant by that is that so going back, give you a little history about this. So prior to World War II, there really was not much of a healthcare insurance issue, our industry, but there was not that much healthcare either. Healthcare really started becoming expensive when major surgery started becoming feasible after World War II. That's when the costs really started taking off. And on top of that, after World War II, there was a very strong need for workers. In other words, there was a worker shortage after World War II because the U.S. was booming. The guys had been away at war, all that stuff. So companies, private industry, not just healthcare, but all industries, started offering healthcare benefits as a way to recruit workers. It's another benefit to recruit workers other than salary. So that kind of became the norm in America, where it didn't become the norm in many other countries, many other Western countries. And that kind of took over. And the problem with that is the cost of health care is not constrained in that system in any way. In other words, the consumers, quote, patients, say what they want, and somebody will respond to it because you can make money off of that. And I said that about consumers versus patients and creating a disease. It's not so much that the drug companies create a disease in that they respond to a consumer desire. So, for example, the Ozempic is the perfect example. There was a massive consumer desire for something to help you lose weight that didn't make you have to diet, didn't make you have to exercise, didn't make you eat right, any of that stuff. The pill to make you lose weight has been wanted by U.S. consumers for decades. They simply fulfilled that desire because they knew they could make money off of it too. That's not illegal. Is it
No.
ethical? Is it immoral? You could argue that. But that's really the whole thing is that the U.S. healthcare system is tied to healthcare insurance, which is tied to shareholders. In other words, health insurance companies are also there to make money. They're not there to, that's their purpose. And there's nothing wrong with that. It's not that they are unethical or bad or illegal, just in and of themselves. A healthcare company is just like any other company. They're there to make money. If they weren't making money, there's no point in their existence. So that's where I think the U.S. has gone wrong. Most other developed countries have some kind of a different model. Most of them are somehow government funded or centrally funded by the government. Canada is an example of that. The UK, for example, is kind of in between. They do have a federalized healthcare system for the UK, but they also have private insurance if you want it. In Canada, you can't. You can't buy health insurance in Canada. It's illegal. You have to use the government healthcare center system, which is why, as somebody mentioned in the chat, so many people in Canada who want surgery, for example, for hip replacement or something like that, they'll come to the U.S. because they can pay cash and get it in the U.S., whereas if they wait on the Canadian Health Service, they're going to be waiting for months to years.
I've heard that.
So at any rate, there's all kinds of systems. One of the ones that I kind of like the best is the German system. And it is centralized again. In other words, it's a single payor system. There's one entity that pays everything, but it's a nonprofit foundation, basically, or a series of foundations, in fact, rather than a for-profit company that has shareholders. So if somehow in the U.S. we could cut the need for shareholders out of it, we would cut the need to make money as part of the healthcare process. I hope somehow we can do that. I don't know how that's going to work at this point. Obamacare, which was much touted, or the Affordable Care Act, is not the answer, clearly. But I don't think we have an answer otherwise. On a personal level, I have felt for many years the pain of telling somebody, say somebody with cancer, because as I said, I was an oncologist, that I can't treat you the same way I treat somebody else because you don't have insurance. And I've had to do that. Or, I don't put it quite those words, but in my mind, I know that's what I'm saying.
Yeah.
And that's very painful. That's very hard to do. And I wish we didn't have to do that. I would like to think the U.S. is better than that we could do better than that somehow. Right. But I don't know what the answer to that is. I don't know how we do better than that.
I agree with that.
I'll stop. I could go on for hours about that.
I feel like I wanted to mention this to you. Diabetes, for example. I know several people who take medications or insulin shots or whatever it is to control it, if you want to say. To me, it feels like they're just living their life with the same diet that they had before they were diagnosed, and this is just masking the issue. True. And that breaks my heart that they don't understand or take the responsibility to know, or their doctor doesn't tell them completely, whatever the situation is. It's just like, oh, that's not how it works. That's not your cure for diabetes.
It's a help for diabetes, definitely.
But do you think they really don't understand? Or is it just that eating the right diet and losing weight is too hard?
I think
it can be a combo, but yeah, so that's going back to the Ozempic. Like you said, so many people have been looking for that answer, you know, to just take this, lose weight.
But again, what was Ozempic created for? It wasn't weight loss, was it? No, exactly. So people found out like, hey, I can starve myself by taking this drug and lose all this weight, but I'm really not doing my body any good, because now I have to rely on Ozempic to keep me skinny.
Yeah.
Unless I want to do a dietary program. And that is horrible. And I'll tell a story from me is that when I was playing pro hockey and working out all the time, I was trying to find whatever I could to stay skinny, stay at a playing weight, which would be, unfortunately, would have been about a 165 at that time as a goalie. And I would do whatever. Well, when things weren't working out for me quickly, I started, I was working out. I was doing everything, but I was a bulimic, and that was the way that I was losing my weight. Now I look at Ozempic as something similar, except you're not screwing the insides of your body up, but you're screwing your body up with Ozempic as it is, doing it what it's not used for. And a lot of people, I think, take drugs, certain medications, other than what they were created for. Well, we can go for fun and say Viagra, which wasn't created for what it's used for now. It was I believe, an antidepressant. Now, I guess that
and or an antihypertensive. In other words, they're experimenting with drugs like that to try to find another drug for blood pressure, and they came up with Viagra.
Okay, and to me, maybe that would help with,
And it does. It works. Yeah. It doesn't work very long. It only works like a few hours, so it's really not useful as an antihypertensive on a practical basis, but it does work.
And they found the other use for it.
Yes.
They found the other thing they can make money off of with it. Yeah, sure. Rusty, let me ask you this question. This is something I've been wondering, because our country and other countries around the world have been pushing certain diseases as being the next big disease that we need to worry about, such as bird flu, swine flu, mad cow disease. And then, they're telling us that, oh my gosh, if you don't prepare for this and get ready to take the medications for it or whatever, it could wipe out humanity. But here we are still surviving. And that's where it goes back to me. that they promote diseases to promote drugs for those diseases that really haven't broken out and affected us. I know that the one I really paid attention to, because it was all over the news in the 90s, was HIV. And I can go into a whole separate conspiracy on the HIV thing, but everybody got so worried about getting HIV, whether you were heterosexual, black, white, drug user, non-drug user, that you worried about that so much. And I think that the news really pushed it for you to worry about that. And I think that's what they do with these diseases as well, that really haven't affected but very few people in the world itself, except for maybe and I don't want it, but underdeveloped nations that don't have any kind of health care at all. And again, another conspiracy theory, but I mean, what do you think about these things like mad cow and bird flu and
I agree. Those things all are just what you said. They don't affect that many people, and they're but certainly the people try to exaggerate the potential impact. I will say COVID was the exception to that. Who could have predicted COVID in 2019? Nobody. Even the best infectious disease planners on the planet had no idea that that it would be as bad as it was. So I will say that I really don't think there was a conspiracy. I truly think it was accidental. I think it did escape from the lab, but I think it had happened accidentally. Now, the problem with COVID, or the problem with the way it escaped from the lab was that lab, Wuhan lab, and I know this very well because I actually know Tony Fauci pretty well. I worked with him in years past. Actually, one of my specialties was in HIV in women. So I worked with him a fair amount in the 1980s. But at any rate, so the way it worked was the Wuhan laboratory was a subcontractor to another laboratory in the United States that had gotten a grant from the NIH, particularly from Tony Fauci's division of the NIH, which is the NIAID, National Infection and Allergy and Immunologic Disease. That's what it's called. So they gave the grant to this U.S. lab, and now I can't remember which lab it was.
Was it the one in like New Jersey or something like that?
I want to say it was in the Northeast somewhere.
Okay.
And then that lab subcontracted with a lab in Wuhan to do some very specialized research on the virus itself. And that's not uncommon. That happens all the time.
I'm sure.
I have done that, not with a lab in China, but with labs elsewhere and, and other projects. And what happened is that probably the QC at the lab in Wuhan was not really as good as it is in the United States. And therefore the virus escaped, with a lab tech or something like that who was a little careless. China's population is so massive and they're so crowded together. China has lots of very large cities that it spread like wildfire. And then it made it all over the globe. And I can tell you, nobody predicted that. That was not a conspiracy. It was a series of accidents, basically. So I'm pretty convinced of that about COVID. So I can't blame anyone in particular for that.
Well, let me ask you this, because again, I'm a conspiracy guy. Do you feel that even though it was an accident, it was destined to wipe out the weak?
It certainly could do that, and did to some degree. The elderly, people in nursing homes, people who are immunodepressed for some other reason, people who were significantly obese, all did worse. Some of the things we didn't even understand why they did worse. So, for example, blacks in America did worse than whites, even if they were the same weight, same everything else. And we never really figured out why that was. So at any rate, yes, it did affect, people who are already debilitated for some reason certainly had it worse. No question about that. Was that in anybody's mind? I know, was anybody intending to do that? I just can't see that.
Okay. Because I looked at me being me and I thought that about the AIDS epidemic, that it was made to wipe out certain groups of people. I'm not saying wipe them out. I'm saying to lessen the amount of people. Again, not a doctor, but I look at what I see and read, and that's what I was thinking at the time, is that AIDS was to wipe out homosexuals, drug addicts, and things like that, and that's who it was wiping out. That's who it was affecting the most.
Yeah.
And it just got me. It made straight people worry about having, straight sex with people. You were worried about what ifs, and how is this airborne? Is this saliva to saliva? You were really worried about that, and I think a lot of that got pushed into the COVID narrative as well. That a lot of people worried about that. They're telling us it's the world's worst disease, but wear this little mask to protect yourself when the world's worst disease.
That's the problem. Yeah.
And 6 feet of separation. So I think a lot of it comes down to a lot of not trusting over the years, not trusting what they're telling you, because people have realized or seen in the past that these things maybe didn't come true, or they were maybe pushing a narrative. It's not something we know about for sure, but fear-mongering. I think a lot of people were looking at it that way. Again, when I brought up bird flu, swine flu, and mad cow, I think they were doing the same thing with that. I remember mad cow and how many cattle they were killing, and it was all over the world. They were wiping out the cattle. And then now it went the past year with bird flu, and how bad that, oh my gosh, this guy in so-and-so got the bird flu. I'm like, yeah, that's like the third guy in the world that's got bird flu, and you're really pushing this. And I think that's why a lot of people question a lot of things that go on in the healthcare industry now. And me being one, again, we try all natural. We haven't been sick in 4 or 5 years with anything except irritable bowel. But I'm not saying
you
that.
And me both.
I think a lot of people our age, Rusty, get that way. And I can't eat the spicy foods I used to eat. But one of the things I also wanted to bring up, because a lot of people is what we see in the newspapers and read, like pharmaceutical scandals and some of the big drug company scandals, that lawsuits they've had to pay out billions of dollars. Right now, one of the big things is let's go Roundup. I know it's not a pharmaceutical drug, but it puts you in the hospital where you have to take pharmaceuticals and to get better. And I think a lot of people are looking at that kind of stuff. And yes, bud, castor oil is very good for you. So is
we've been hearing that.
So is
but it's so bad for it. It tastes so bad.
Yeah. But there's so many different things that people worry about now, and it's really tough to get the absolute truth out there, because you're not going to know it. I mean, I'm so glad you're on here, and Erica's going to tell you that we're probably going to have you on for a part 2, because she's got a lot of things that she wants to talk about. And unfortunately, I think I've hijacked the show. Sorry.
You're good.
But we wanted to have a part 2 anyway on this. I just want, again, my biggest thing for people is to question everything that you're reading. If a doctor gives you a prescription, don't blindly go into that prescription. Just look it up. It might be the best thing in the world for you, but look it up so you know something about that prescription, know something about the possible side effects. Because I've never had a doctor sit down with me and say, well, I'm going to prescribe this, but the possible side effects are this. And I don't feel that's their job in a way.
I kind of do. Here's the thing. Historically, doctors didn't do that because there was no access to that kind of information to the public. Now the public can look up and get the same information that physicians get and, repeat it. Now, they may not interpret it correctly, and sometimes don't. But a lot of doctors, certainly guys my age and thereabouts, are not used to being questioned like that. And I think that's something we as physicians need to get used to.
And even if it's not the physician, if it's someone on their team, if the physician says, we are going to have so-and-so come and talk about the side effects and how this will or could interact with your current medications or your current diagnoses, whatever it might be. If they just address it and say, someone here will talk to you about this today.
The way we did it in our, every cancer clinic I've been in, is when you came in, say with a new diagnosis of cancer, whatever that cancer was, you see the doctor says, okay, I'm going to recommend X chemotherapy to you. And then you quickly go over the side effects with them then. But we also then had a class that was given by a nurse practitioner who discussed the side effects in detail with the patients, took questions, and spent like an hour plus with them. Because the problem is the doctors simply don't have time. You have to move on to the patient so you can't.
That's
So
understandable.
that's a good way to do it. The problem is you can't really do that in a primary care setting, or you don't have the funding to do that in a primary care setting. We could do it in a cancer clinic setting because there's a lot more money flowing through the system in cancer clinics, and that's a whole nother issue. But I wish we could do that with every disease.
Yeah,
definitely.
We'll get through the chat, see if there's anybody that's asking anything. Oh,
Yeah, I've got
Candy in this.
You're right. He says they went to school, and who are you to question me? That too many doctors have that opinion, I'm afraid. I try not to come across that way. I'm sure I did sometimes. If you're ever behind and you're mad, or you're mad at the last patient, you take it out on the patient you're seeing now.
Yes,
that happens. I mean, it does. We're no less human than anybody else. But yeah, I hope that we can get past that at some point.
Yeah, I know my mom was an RN for I think 30 plus years, and she worked many different levels. I think she did cardiology for a while, and she was on an emergency room and some other, and she would talk about bedside manners of doctors and how some were like caring doctors and how much they really cared. And, would come in just to check on a patient, just to, hey, I'm down in this area. I'm going to come and see how you're doing. And then there was the doctors that had horrible bedside manners. And she felt, like as her job, it was to, being an RN, it was to make the patients feel comfortable and to be that person that made them feel like everything's, whether they were going to be out in a couple days, 10 days, 20 days, or knowing that they weren't going to be out of the hospital ever. And she was, that she felt that was her job. And I think, and again, like you said, like any job, people go into it. Some days are good and some days are bad. And it's like that with a lot of doctors at times. I mean, some doctors, probably can be an ass all the time, and some, as in any job,
I'm better at it than others.
Absolutely.
It's interesting. When I was in a teaching position for many years, so we worked with students, and yes, nurses are afraid of doctors sometimes, and that's something that's bad too. But I was in a teaching position for most of my career, where I worked with medical students and residents and fellows, and I got to where I could predict almost which of those trainees would go on to be, quote, the good guys. In other words, the guys who could explain it to patients and who patients would trust. And I could predict who would not. In other words, the guys who would not be explaining to patients and leave patients waiting and all that. You could almost tell, like I said, while they were in training. So it's not a function of intelligence. Everybody who comes to medical school has some degree of intelligence because it's hard to get in. It's a function of something beyond that, some other capacity in your psyche to have empathy for patients that we don't measure very well. But if, like I said, many of us who were in the teaching realm for many years could, in fact, tell you, oh, this guy's going to be good, this guy's not going to be so good.
Let me ask you one question while we still have you here. Was it true that during the COVID epidemic that doctors in hospitals were paid per death, per hospital bed? Because we know what we've heard is that when hospitals would say that they were full, that there were shortages of nurses and doctors.
Sure.
Actually. So,
and hospital beds.
Yeah, that's what I'm saying. So a lot of the times when what I've heard is that there were at times, let's say you went to the ER and there were only 6 beds in the ER, and then there are 12 people in there. Now, now the hospitals, they're overwhelmed with patients when they only have 6 beds in general. I was just curious about that because that was something, one of the conspiracy theories that went around that you know, when you saw the dancing nurses videos, and again, that goes back to people not trusting the healthcare system.
Right.
When you see dancing nurses, are like, well, if it's so busy, how do they have time to dance?
Exactly.
And that's the things that I think the healthcare industry needs to.
What I think the point you're making, Chad, is that consumers, patients, don't understand how healthcare is paid for because they're disconnected from it. You pay health insurance, but you don't really pay for healthcare. So there is no incentive on the healthcare providers to come up with itemized statements that make any sense to the actual patient.
Right.
So I wouldn't say that they get paid based on death. However, I will say that there are codes for when a patient dies and you turn that into the insurance company, they're going to pay you some amount for taking care of a patient who dies. And I think that's reasonable because you have to invest your time as a physician. Say I have a cancer patient who I know is not going to make it. And we put her in the hospital, give her hospice care, do whatever. And it takes up, potentially hours of my day every day dealing with her, dealing with the family, dealing with whatever. Should I get paid for that, for my professional expertise? Yes, I think that's true. So do we get paid for deaths in that sense? Yes.
Okay.
But I think that's appropriate.
Okay. That sounds more appropriate. I mean, compared to what it was being pushed at the time.
I can see that with coding, and it all matters with coding as far as billing. And, it's just being on the other side. You feel a different way with certain providers compared to others. And some may invest more time in caring for that patient, and it's just, you don't get that a lot with the medical field, and that's not really what they're there for, but it's like an added bonus if you can get that.
Exactly. Our system works against that. And you're exactly right. It's a value added to be able to discuss frankly and appropriately with patients. That doesn't get paid for.
Yeah.
Sadly.
Well, I know for sure we'll have a part 2 on this. We'd love to have you join us. It's not necessary. I know your schedule's busy, but we will have a part 2 of this. So we'll let you know. We'll message you just so that you know. And
thank you. I'll do the best I can.
And everybody that's in chat right now, please promote this show. I mean, I'm not begging you. We're not ever trying to be monetized. I'm saying promote it because there's a lot of things that we talk about throughout different shows that I think are interesting and people would like to hear. So just promote it that way. And I think shows on healthcare, I think that's a big deal. And I really think that you would like your friends or whoever to hear these shows as well. We're trying to do something different, just trying to help out and for people to learn things. I mean, I've learned stuff from Rusty tonight that, kind of eased me a little bit, as far as of an actual doctor there that I know. I've gotten to meet Rusty. He's a legit dude. And I feel that I feel that I can trust what Rusty says. Yeah. So I highly promote it. If you have people that are taking a lot of medications, the next episode might be even better for you to listen to. And it's with everything, we did the bug out, bug in, and all of those shows, and people learned a lot from those. So, share it. Let people learn on this stuff. It's not your typical Bigfoot show, and we'll do some cryptid shows for sure. But I just want people to learn new things. We want people to learn new things and have fun with it.
I personally have had a hard time in the past speaking up for myself. And so this is like our opportunity to encourage people to speak up for themselves, and question things so that we understand it better. This
is done as a group. We that's why people ask questions in chat. We want to be able to try to get an answer for you or to learn from you, because we are not doctors. We are not professional. We're not paramilitary or bug out professionals or whatever. That's why we created this podcast.
Yep.
I learned something today that I didn't know. Sharon in the chat told me that she can get a drug called Palaxia, Palaxia, for which the other name is tapentadol. We can't get that in the United States. And when I saw that she was getting, I figured she must be from overseas, which it turns out she is. And now
No,
Yes.
where Sharon is from, but apparently they can get it there. Palaxia or tapentadol has not been given a scheduled listing yet in the United States. It is an opiate of sorts and is available, obviously, for pain relief in other parts of the world, but not the U.S. Most doctors are aware of it, but we can't prescribe it in the U.S. yet. So I
Okay.
love
Okay. Yeah. And we know, that's the other part of this, us discussing this, and it will be in part 2 for sure. But reflecting on what we've been through in the past and how we've seen things unfold and the different procedures and how things have grown and things that we've learned to make it different for the future. It's, the medical practice, no matter what field, you're always learning things and you're always, things change, medications change, policies change, so
Politics
we
change.
can all, I think, reflect on that.
Absolutely. So
someday in my podcast, or maybe when you guys do your next one, if you'll have me, I'll give you my full take on Tony Fauci and
Okay.
what happened with him.
Okay.
would love to.
Yeah, we would be curious to hear that for sure.
I think a lot of people would. So, again, thanks, Rusty, for being on here.
Yes.
Appreciate it.
Thank
You're
you.
very welcome.
Next time we'll have you on from the beginning. We just kind of wanted to talk a little bit and get what we've researched. Now, not everything we've researched is, I got most of my stuff from actual medical websites, and I'm sure she did too. And I just wanted to touch on things now, obviously the scandals. I kind of wanted to hit that with the pharmaceutical industry, but I think everybody knows that they've heard the lawsuits and the companies that have been at the center of the lawsuits. Like I said before, when I took Surzone, next thing I know, if you're a victim of blah, 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 and Surzone, contact this lawyer. And I'm like, wait, I took Surzone. What the heck? So, then I researched exactly what it was doing to people. And it was doing what I described earlier. It was giving me suicidal thoughts and everything. It was supposed to be an antidepressant. So I stopped taking it right away. So, that's the kind of stuff that when we push people to research what your doctor is giving you, make sure you're telling your doctor everything that's wrong with you.
Mm-hmm.
If you're even if you're taking multivitamins, tell your doctor you're taking multivitamins. If you're taking Flintstone chewables, tell them.
Yeah, it all counts, in the
Absolutely.
big picture.
But anyway,
Even herbal things.
yeah,
Some
I
of them
agree.
don't make a difference, but some of them do.
Yep.
Mm-hmm.
And I've read that with some of our herbal not medications, but some of the herbal stuff that we've taken is consult your physician, and if in case you're on this blood thinner or blah
Right.
blah blah. So yeah, 100%. Would you like to give us the outro here?
The outro.
I mean, we're kind of
Yeah. So we will have a part 2
absolutely.
of this. Do you want it to be next Sunday or?
If he's available, I would love to do it next Sunday.
You don't
I'll
have to
let you
tell us
know.
now,
We're going to have
yeah.
family from out of town for the 4th, and I think they're staying through Sunday. So
That's a good
I'll
point.
let you know. I'll let
Okay,
you
Okay.
please do.
All right.
Do.
All right. So guys, we don't know our topic for next Sunday yet, but we will, and that'll be the 6th.
4th is Friday. 5th, 6th. Yes.
Yeah. So we'll be on. We don't know the topic yet, but we'll let y'all know this week. Rusty, thank you so much.
So much.
You're very welcome.
And thank you everybody who's been in chat. Anybody who watches, we appreciate it, and we just really want to help each other out.
And yes, Patrick agreed 100% that we need to discuss things like this. And it's very nice to have an actual physician here or doctor that can help us with some of this stuff. So that's great. Thank you again, William. I can't thank you enough. So everybody, thank you.
Yep.
We will hope you have a great rest of your Sunday. Enjoy the day. I know here in Middle Tennessee, it ended up being pretty nice and cool. So hopefully it's like that for you in Florida, William, and everybody else out and about.
Partly cloudy and warm. Boy, it's been hot the last
Yeah.
10 days. It's been in the 90s and sunshine almost every day, but we have periodic thunderstorms, and that cools it down a little bit. But boy, it's so humid. It's so hot.
Yeah.
Typical Gulf Coast weather.
There you go. I was gonna say,
true.
aren't those mid-afternoon thunderstorms pretty normal? Yeah.
Yep. Rains every day in the summertime almost.
Yeah.
Mm-hmm.
Well, again, thank you everybody for joining us.
Thank you.
We
Very
appreciate
nice
it.
show.
And hopefully we'll see you next Sunday at 5:00 Central, and invite friends, please. If you haven't subscribed to the channel, please subscribe. And I highly suggest checking out William's show. I
Yes.
really enjoy William's show. A little music, a little medical. It's fun. It really is. It's something different, and that's what I like.
Do you want to give us a quick overview as we head out? How
Sure.
they can find your show?
Yes, The Blues Doctor Recommends is the title of the show, and I am, in fact, the Blues Doctor. It just reflects, as Chad just said, things that I'm interested in. So I do, in fact, include a lot about medicine, particularly cancer, but other things as well. Plus music, because as many of you know, I am a part-time or amateur musician and have been for many years. So we talk about those kinds of things. Anything else? We talk about a lot about New Orleans because I've lived there for many years. This week, one of my topics I'm talking about that is, I don't think I've talked about before, is professional wrestling, which is one of my favorite things. So we'll talk about that this week. And that episode will be out at midnight this coming Tuesday night.
Okay.
All right.
Awesome.
I love it.
And then usually he'll play a song for us, so that's entertainment too. But his is one of the best podcasts that we've been able to listen to and watch. It's truly entertaining.
That's not our cryptid ones. We love all of our cryptid podcasts, our paranormals, but his is different, and it's just another.
It's an
And I even talk about cryptids sometimes too.
Yeah.
It's an excellent format that he uses, and it's creative. I can never remember the term that you use. It's not dark things, but what is it? The curiosity. What's the term?
High strangeness.
There you go. I love that. Yep. Yeah.
And I won't
we
take
love your
credit
show.
for creating that. I've read it online for a number of years. I don't know who came up with that originally.
Yep.
Wasn't Miss V's podcast? I think she had high strangeness on the end of that on her first podcast she had.
Could have been.
I think so. I think so. But I'm not. Don't quote me.
Well, thank you, Rusty.
Yep. Thank you, everybody, for being here. Look forward to seeing y'all next Sunday. Same bat time, same bat channel. And have a great day.
Good night, everybody.
Hit it. No, hit it. And then hit the bottom one.